And so then that really got my mind spinning on one, how I heal and work with gymnasts, but two, wow, how could we make them healthier because they're stronger and improve performance? Like, honestly, everyone, how does our body feel? Where are our backs at? And then if you're like, oh, we're feeling a little, okay, well, what can we do about that?
Hello, beautiful people, and welcome to season 3 of Flipping Out with Bridget Sloan. I'm your host, Bridget Sloan, and this season we are talking all things NCAA gymnastics, from the athletes to the coaches to the insiders who make it all happen. And for today's guest, Jenny Borda. All right, Miss Jenny, welcome to the Flipping Out podcast. I am so grateful and thankful and just excited to have you here.
Yeah, thank you for having me. I'm excited to talk with you.
Yes, we have a lot to talk about. But before we get into how awesome you are at being a doctor of physical therapy, I do want to give the listeners just an understanding of who you are, but also just what gymnastics means to you, because it's a sport that you really focus a lot on in your job. So I would love to, again, just get a little backstory on who are you and how did you kind of get to this point of where you are in your life?
Yeah. So we'll start, just a few years ago. I grew up, so I was born into basically a family where both of my parents coached gymnastics when I was little.
Okay.
My mom still judges. So she still judges like a bunch of college meets and stuff like that. But my dad's not involved anymore. But I grew up in the gym. So the very typical gym rat, the little toddler, like running around in a leotard. And so started competing when I was young. Really could do all kinds of things until the back tumbling, like mental block bit me. And that slowed me down. I took some time like out of the gym. I danced a little bit. I went back toward the end of high school, was able to work through some of those things. But still, when you're talking about, 20 years ago, a little over 20 years ago, we weren't as good at working through that or coming up with different skills people can do. So, it still really affected me. I ended up walking on Ohio State's team, and I was mostly good at bars, fairly good at vault, but then with the backwards stuff, not great at floor beam. Went and had some shoulder stuff that I had a hard time getting better, and ended up it just wasn't the right atmosphere for me. But I loved Columbus, I loved Ohio State, so I stopped doing the team and I started coaching gymnastics. At just a local gym in the Columbus area. That's where I live, Columbus, Ohio. So Region 5. You're from Region 5.
Woo!
Yep, little Region 5 shout out. So I was coaching, and I coached all through college. I was a journalism and communications major. So you'd think, oh,
amazing.
Yep. You're like, oh, that leads to physical therapy. But I think really what happened is because I loved coaching, I never took internships. I never did anything like that. So when I graduated, I was like, I don't really know what I'm going to do. So I started coaching full-time for a couple of years. Really thought about like, is this everything I want to do? Do I like the hours? Is this the life I want to have? And decided, I don't know, like these kids are hurt a lot. I'd love to have more answers about this. Like I stopped doing gymnastics with a bad shoulder that couldn't get better. I'd had at that point a handful of surgeries. So thinking about those things, and I was like, well, maybe I'd like to like help athletes in that way, and kind of just decided to apply to PT school. So I had to take a couple prereqs since I wasn't intending on doing that. So went back, took a couple prereqs, ended up going to Ohio State also for physical therapy school, got my doctorate, coached that whole time.
Wow.
Got a full-time PT job, and really chose a PT job that allowed me to still coach. I wasn't originally going to work where I worked at the Children's Hospital in Columbus in their sports department, which I thought was a really good mesh. But I wasn't going to work there because they didn't have hours that would work with coaching. So still, even going to school and getting my doctorate, I was like, coaching, that's it. That's what I still need to do this. So I really worked it out where I was working a ton. Coaching, having a 40-hour-a-week PT job.
Wow.
Until that really just got, I couldn't sustain that. I wasn't really growing in my personal life. I wasn't taking great care of myself. So I ended up stopping coaching. I started competing in CrossFit.
Heck
and so kind of that whole piece of things led to where I am now, right? I'm competing in CrossFit. I start focusing on my life as an athlete. I'm learning more about weightlifting, which I really knew nothing about before. I start realizing like, wow, I can go into the gym and do like every skill on bars that I could do 15 years ago simply because I was strong, not because I'd been doing gymnastics. And so then that really got my mind spinning on one, how I heal and work with gymnasts, but two, wow, how could we make them healthier because they're stronger and improve performance? So I started putting more time into working on that stuff. And then really, COVID was a little bit of a blessing for me because I feel like we were off my clinic job a little bit. We're not there as much. And people were reaching out like, could I work with you on this? I'd like to get better at this. I've had this nagging ankle, like these things, but not really true physical therapy. And I was like, I think I could do this on my own. And I thought about it for a long time, but I think it was just too scary. Yeah. But that was really what allowed me to like make the jump. So then end of 2020, I left that job completely and have been doing my own business full time since then.
Wow. I love to hear that you do CrossFit. Love that. I think every gymnast deep down, as much as they don't want to admit that they would like CrossFit, every gymnast likes CrossFit. And I say that because it has like, it's a competitive, it's competitive. Let's just point blank there. Yeah. But also when I was doing CrossFit, I was in the best shape of my life. I really was. I was the strongest. I was the leanest. And I think because growing up now in my era, and you can probably attest to this, lifting weights was like, don't do it. You're going to get bulky. You're going to have too much muscle and this and that.
Very much.
I feel like there's been such a huge shift, a beautiful shift, a much needed shift. What would you say is the reason for that shift? Like when do you think it was like the light bulb came on and gymnastics coaches all of a sudden were like, hey, maybe lifting weights is a good thing?
I mean, I don't think the light bulb has come on for everyone.
Fair.
I do. So I run like a teen weightlifting group for girls. It's big in the summer, not as big during the year. It's a ton of gymnasts. We've seen really good results with that. But, I think the changes happen, one, from as people of our generation come out and hopefully still love gymnastics and want to coach and do those things. They've maybe had better experiences with fitness. I mean, I don't know how. Actually, I do know because you talked on your podcast. I think maybe with Jordan about it. It maybe was with Alana, but you talked about how hard it is to get out of gymnastics and out of college and like understand fitness. And so I think that that's part of it, right? Is as you find different things and what do I want to do? And I think people gravitate towards like Pilates and doing that stuff, which is good. And I like Pilates. I did Pilates stuff and I was Pilates trained and that's how I treated patients my first handful of years. Yeah. But then I started realizing like, I just, that isn't really getting the results I want or what I would want to see in the people I work with. So I think as our generation learns to enjoy weightlifting ourselves, then we can teach that. I think that colleges have done a much better job with weightlifting. It did happen. I don't know how much you lifted when you were at Florida. We went in the weight room, but I wouldn't say it was all the time. And I wouldn't say it was like geared toward things that would be better for gymnastics. So I don't know that it was like the best weightlifting. So I think as colleges dive more into weightlifting, because there are things that I like gymnasts to do weightlifting wise and things I won't do with them very much. Right. Because I'm like, yes, they should be able to do this, but for the most part, they don't have good enough stability or they aren't going to be in the right position. I don't want their backs to start hurting because I made them do this lift. So I think as we learn more and in colleges, obviously you see like, especially preseason, all these girls lifting and stuff. And that starts to get people, even if it's not coaches, like parents and athletes, like maybe I should be weightlifting some. So I think it's just been this progression as the people that coach mostly in like, 80s, 90s, early 2000s, as they age up and some other people start coming in, it starts bringing those new ideas.
Yeah, I think so. I had a very positive experience at Florida with our weight coach. Honestly, the weight coach we had is one of like my mentors and I still connect with her. I still keep in touch with her. She's absolutely wonderful. But one thing that I think is so unique is that every gymnast is going to need something different. Gymnastics is such an individualized sport, and that is even true in the weight room or when you are doing, that extracurricular physical, whatever you want to call it. Everybody needs something different. And I think the beauty is that you are able to not only see what an athlete might need, but you're able to give them that individualized attention. I
Yep.
mean, just talk about that and what with your business right now, just kind of what that looks like.
Yeah. So, there's a few different parts of my business. I would say I am a physical therapist, so I can
Mhm.
treat injuries. I have a couple people right now that had surgery, things like that. So, very what you would consider traditional therapy.
Right.
But a big bulk of who I work with, which I probably 90% of my clientele are gymnasts. The rest, I have some adult CrossFit athletes. My office is actually out of a fitness facility. Um, I coach some classes for the adults there. I have a couple other high school athletes, sometimes college athletes, if they're in town or they're coming home for different
Mhm.
breaks, they'll come in to work on stuff. Not always gymnasts, but still mostly gymnasts. And so I think for me, a big piece of it has been wellness. Like we have this continuum of, yes, we're recovering from this injury, but your body is always going to need something. And we're probably not hitting it all with gymnastics conditioning. And a lot of times, so this time of year, I get way busier, like
Mhm.
sometimes double the visits, simply because people's bodies are breaking down. They're coming season, even, college athletes. So I work with college girls in person, but also I do some virtual with some different college girls just because sometimes you need more of that individual,
Mhm.
someone who understands your sport. And so I feel like really being able to say, like, ooh, maybe we need more of this, or tell me what part of the skill it's bothering. And you can kind of come up with a drill or an
Mhm.
exercise that would really address whatever issue they're having in that can be helpful. So this time of year gets really, really crowded because people want to come in to fix problems. I wish more people were like, wow, can I come in to work on this more preventatively? Or I do like an online program that people can do and it's 3 days a week and it really hits like areas that gymnasts just have weakness. Like I've tested
Mhm.
thousands of gymnasts. I've been a PT for almost 16 years now. And so there are some really common spots that gymnasts just need to be stronger and they aren't. And there's also some really common areas they don't stabilize very well. And that leads to issues and problems. And if you could just address that from the very start, hopefully we don't see as many overuse things. I do think that
Mhm.
can even solve. I mean, obviously you're going to have some traumatic injuries, but there are traumatic injuries. I mean, you talk so much about college gymnastics. If you talk about like Achilles, that's a traumatic injury that you don't
Oh,
want to say, oh my gosh, we can't do anything about that because there's plenty we could do. Can we fix it
yeah.
completely? No. But are there things that we should be doing? Should we be, if you think about college programs, it's always really, I love talking to girls from different colleges because you get a little flavor from each and what's good and what could be better and what do you need specifically, like why are you contacting me. um but I think some of that is if we don't have someone either like weightlifting or training or doing those things that really does understand gymnastics and has rehabbed a lot of this stuff, are we getting everything? Are we hitting the places that are weak?
Mhm.
Could we have more individual programs for the gymnasts where this person needs to be working these things like that? So I think that's just working on wellness, is just such an important piece of it.
Mhm. Yeah.
So that's why what I do is a lot of wellness work, trying to stop injuries before they happen.
Well, and there's so much more. I think the term wellness has it's a very broad term. Wellness is not just one thing. There are so many elements that go into
Mhm.
your overall wellness. And you brought up the Achilles. That is my to this day, that is my biggest fear. Like, I'm not
I
afraid of a
agree.
lot of things. I am petrified. Oh, just thinking about it kind of gives me the chills.
I coach adult class, and when we have to jump, I'm always like, "Oh, I'm not gonna demo this
Oh,
because 'cause I'm not warmed up, and the last thing I wanna do is have my Achilles pop in front of all these people."
mhm. But specifically, there was a year in NCAA gymnastics where it seemed like we were going through an Achilles tearing pandemic. There were more Achilles tears in a year, and I don't remember exactly what year it was, but then I would say almost any year. And it
It
was
might have been,
always
like, 2 years ago. It was 2 or 3 years ago. It was
2 or
pretty
3. Okay.
recently.
I'm sure that the Gymternet will let us know. Um, but one thing that always stood out, like, I was always a very muscular gymnast. I was always strong, my muscle, it didn't go away, it hasn't gone away, and it probably won't. But it was so interesting to me as an athlete, I never thought about Achilles at all, ever. Not once in my life as an athlete. And then after I graduated, it became like the front of my fears and so it was just interesting. And I would love to know your perspective on just, again, preventative work and you kind of hit on it already and just the importance of it, but specifically, your Achilles, there's so many things you can do to help prevent that
Yeah.
from happening.
Yeah. And I think some of it's hard because there's not always like a ton of research on it. So,
Yeah.
there's people out there that are like, oh, well, I mean, I'm very comfortable saying like, this is what research says. And then this is my opinion and things I've seen and things I've worked with. I always think, oh, I should do some, even if it's just a study asking people things, because I
Yeah.
have some theories that just seem pretty true. I wish I'd like literally had little notes on everyone I've ever seen to like look back at
Yeah.
stuff. But, I think that things we can do to help prevent it is have really good hamstring strength. I would
Mhm.
say the majority of people I see with Achilles issues, so whether it's a rupture, it's tendonitis, have weak hamstrings. So, you know, my calf can't really do the job of my hamstring, but if my hamstring's weak, my calf's going to try and it's going
Got
to
it.
overwork. So hamstrings is an area that I really like to hit hard. Ankle motion. And a big piece of this is
Mhm.
sometimes people are a little tighter, but a big thing I see like this time of year is we've taken harder landings. And yes, we're going to land short occasionally. But I think, we land short. And then if we don't really properly manage that and then we land short again, that can actually change like how far your ankle can flex. It can like help
Mhm.
you build extra bone and keep inflammation in certain areas. So now suddenly if I can't bend my leg that far, but I force it into a position,
Ah.
that's not going to be good for it. We have that. We have, you think, oh, when someone's sore, let's put
Mhm.
them on a softer surface, right?
Yeah.
So a little more tumble track, or we can go rod floor, or we have this softer floor compared to this. But, most Achilles ruptures happen in competition or on competition
Right.
surface. And for the most part, if you've been training more on soft surface and then you go to something firm. So we also do most of our plyometric activity on something soft and springy. So like, should we be training some plyometrics on a hard floor?
Yeah.
Like an actual, like a basketball court, not even like, so
Oh.
yeah. So
Oh,
like,
that's
can, can we be doing some springy, like on a CrossFit gym floor, right? On rubber matting,
right.
not just on a spring floor where most people do their plyometric work, which should we do it on a
Mhm.
vault way where it's a little bit firmer? So I
Oh.
think, can we provide better tendon strength or,
Mhm.
yeah, tendon strength in general? It's
Yeah.
not like a muscle, but can we do that by putting a little bit more force? And that's like an opposite thought because I think some people are like, ooh, we should do less. And we don't want to do
Yeah.
that. I think a lot of times I think back to when I coach, like when we did plyometric work, like you're thinking you're working plyometrics with athletes, like plyometrics needs to be a short burst and then you really rest to allow it to
Mhm.
repair. Think about like when you do mat jumps or you do things like that, you just go in the little circle and you just keep
My God.
jumping around. You don't
Mhm.
wait 5 minutes between your rounds of punching. So it's little things like that. Like, just how we train. Gymnasts are normally very quad heavy. We do a lot of heel raises, but do we do enough hamstring work?
No, we don't. As someone who has the
Very true.
weakest hamstrings, I have the weakest hamstrings because I use my back for everything, and when I tell you back pain is the worst, strengthen your hamstrings, people. Strengthen your
Oh, yeah.
hamstrings.
Oh, we could talk for a really long time. So backs is the thing I see the very, very most
I
because
figured.
yeah. But I think there's a correlation between back pain and Achilles stuff. Like I've had multiple people that it started as one. So that's another thing I know, sorry, your fear. So, I think that if I've had this back pain, right? I don't know how to
Mhm.
stabilize. So what's the typical back problem for gymnasts? It's I'm strong. So I will never say gymnasts don't have strong cores because they do. They can do a ton of
Mhm.
leg lifts and pike ups and all that stuff. But if we're talking about true stability,
Mhm.
right? Not always good. Like don't know how to use like their deeper core, their transverse
Yeah.
abdominis, their obliques. They really overuse the front. So think about, if you're listening and you like drop down into a hollow hold and you get a little cone in your belly, like that's not good core stability. That's like one part of your abs working.
Right.
If I go to do something. So you can tell me, like when you went and started lifting and stuff, you said you've had all this back stuff. This is how I was very much. I've had a million back episodes.
Mm-hmm.
You just crank in when you go to do a squat, like you like arch that back as hard as you can to really get it tight. And that's how gymnasts usually think they're going to stabilize. They're usually like, okay, I'm going to be stable. So I'm going to like really.
Yeah. Like so I have no medical background, but it was like my SI joint just she's not great. Like she's
Okay.
not kicking, she's not doing anything. And I noticed, so the reason I stopped CrossFit ultimately was because I was noticing like my back would flare up, and again, as a as a working adult, you don't get massages every week, or you do, maybe you do. I did not. So I was
No.
essentially losing all the things that I was so used to having, and my back would lock up to the point where I was like,
Mm-hmm.
"Oh, so this is old age. I've met my old age. Here I am."
It's not old age. It's that when you were a gymnast, you stabilized one way. And so you've
Yeah.
had however many years that you started gymnastics ago, we'll say
Right.
25.
We're gonna say 20.
Okay, 20. Okay, 20.
Well, my age right now, oh god, we don't need to say that. I was a
Okay,
gymnast
so
for
if you
20
started
years.
gymnastics 20 years ago, we'll just say that 20 years
Yeah.
ago, right? Which isn't that, I don't like thinking about things like that sometimes,
Mm.
but you've had 20 years of stabilizing a certain way.
Right.
And for the most part, that's overusing a back. It's not understanding
Mhm.
how to actually use our deeper abs.
Right.
So if I overuse my back, and now I'm not using my glutes and my hamstrings very much. So I've overused my back, and now I need my calf to do a lot more work because I don't have the only strength I have in my posterior chain is my calf and my back. So now I'm overusing those two parts all the time. So I have back
Mhm.
problems and then my Achilles gets tight. And so that's where I think they're really like because I know we're on video and I feel like if you're just listening, because I don't ever watch podcasts, but like I guarantee this position is something
Uh-huh.
that all of us gymnasts know way too much about.
Oh, yeah.
Like the
Yeah.
anterior pelvic rotation. And so when we do that, we're turning our low back on and we have trouble getting our low back to turn off. And if we have trouble getting our low back to turn off because that's our stabilizer, we're going to have stress fractures. We're going to have disc issues. We're going to have SI
Mhm.
joint problems.
Oof.
And we're going to think, one, how many gymnasts do you talk to that are like, oh, well, my back hurts because I do gymnastics. But like, that isn't
A
why your back
lot.
hurts. You're a lot. Oh, I mean, I talk about it all the time. Like, I had so many back problems at the end of high school. I had so many back problems doing CrossFit. Probably every couple
Mhm.
of months, I'd have a back event. And like, finally, I really dug in. Like, and
Mhm.
that also made me feel dumb. Like I was a PT who like treats all these backs and I can't figure out my own back. I really dove in and had help from a couple different medical professionals. Did my own research, tried some different stuff. And
Mhm.
I'm gonna knock on wood, but I rarely have any back stuff now. And I think like very truly, and I did for a long time. I was like, oh, like I'm over 30. That's why my back hurts. And I did gymnastics and that's why my back
Naturally.
hurts. But what it comes down to is I was a terrible stabilizer. And like, I remember going to PT when I was 17 and having him be like, well, you need better core strength. And I was like, I'm not going to listen to you. Like, my core is strong. And so it was strong in the way I thought. And so he never
Right.
explained to me what he was talking about, but he also just threw harder and harder V ups and all this stuff at me. Well, I can do a
Right.
million V ups in practice. I never learned how to use different muscles. So I think, that's a big piece of it. So saying they're connected, I really think they are. I mean, that's the kind of survey I would be interested at looking at, right? Like you take all these people
Right.
who had Achilles tears and then you ask, like, do you have back pain? Like I know one gymnast who done with college now, but I remember working with her on some other things and she said, and I was like, does your back hurt? Just because of how she was moving. She's like, well, yeah, it
Mhm.
hurts every day. And I was like, why didn't you tell me that? And she's like, oh, well, that's just like normal. And I was like,
That's my normal back pain. It's not a
yeah,
big deal.
right. It's just my normal back pain. And I was like, oh. And so I was like, well, wait, we should work on that some. But I didn't work with her all that often. And she wasn't concerned about it. And
Right.
then 2 years later, Achilles. And I
Oh
was
my
like,
gosh.
oh. And I mean, she's a good college athlete. So like
Yeah.
that kind of stuff, I'm just like, oh, like this is why we should be getting more. That's why I'm so thankful you wanted to talk about this stuff is the more we can talk about it, the more, I know a lot of people out there listening are like, this isn't about college gymnastics, but it is, right? And
Oh,
if you're a
yeah.
college gymnast or you're a college coach, like we can improve these things So, it is a big deal if your back hurts. It is a big deal if
Mhm.
you pee when you tumble. Like that's a big deal.
Well, very common, actually. I was not one of those, but
So common.
I knew
But
a
that's
lot of
interesting that
people.
you weren't, because normally back pain and some like stress incontinence, so a little tumble
Mhm.
tinkles, um,
Tumble tinkles.
that was you. We have to give that. I should look it up. Like I did a pee reel a while ago that did really well on Instagram, and
Mhm.
someone called it tumble tinkles, and I was like, oh, that's perfect. So I didn't
Interesting.
create that. Thank you, Instagram follower. But a lot of times those go hand in hand because back
Mhm.
pain is typically because of a non-functional core. Like, yeah, it might be strong, but it isn't working the way it needs to. And so they go very closely. So congratulations on being one of the few
Thank
that
you.
has back pain, but no, tumble tinkles.
No tumble tinkles over here. Well, and it's funny that you had someone say like, "Oh, it's just my back pain." Like, that was me.
Yep.
Back pain is just such a normal for me, but I will say I do think there are more people that are speaking up about it, because you have to also remember back in the day, my generation, I mean, I can speak for myself. You didn't speak up when something was bothering you, and
No.
you didn't bring it to, you just didn't talk about it,
Mhm.
and I've always thought, like, why? And because there was never a reason to not do it. I think it was a personal, like, "Oh, if I tell them something is hurting, they won't think I'm good enough." Or if I tell them that
Yeah.
something is hurting, they'll think less of me, which, ugh,
Yep.
hate that mindset. Get that mindset out. Mm.
Yeah.
We could talk about the mental part of what gymnastics does sometimes,
For
all day,
sure.
but I do think that there has been a huge shift in athletes and just people in general being open about, "Hey, this is bothering me.
Hmm.
I'm not able to do X because of this. How can I
Hmm.
fix it?" And I really think a huge part of that is because conversations are happening.
For sure. I mean, I think that that's the joy of things like podcasts and social media is you're getting more information out there, and the more educated you can make kids and families,
Mhm.
the better that's going to be. You're not going to be able to change every coach, right? So
Right.
in the girls I work with, a huge piece of what I do. So that's why I like to call things wellness, right?
Mhm.
Actually, later tonight, I'm having a dietitian talk to my subscription group. So trying to encompass all parts
Mhm.
of wellness. And so, the mental aspect, and really trying to be like, you need to tell them if this is hurting, and like we have to practice conversations sometimes because they aren't sure what to say. And,
Mhm.
there's kids that'll be like, well, I don't want them to get mad. And I'm like, well, they're not going to be mad
Yeah.
at you. Like, you need to be honest. And are there coaches who sometimes are like, oh, okay, I guess we just can't do that then? Yeah, it doesn't mean they're mad. But I think that's the piece of it is we need to think like, if they're hurting, okay. If they can't do something, okay. Like it's fine to
Yeah.
say, if you're hurting, I don't want your body to feel worse.
Right.
And so I don't want you to do this, but that means we might not be able to compete this weekend. That's a fine thing to say. But a
Mhm.
lot of times the response is like, well, if that really hurts, we're not going to be able to compete. And those are two
Yeah.
very different responses. And so I think, kids don't want to disappoint. They don't want to get in trouble. They want to compete. They want to be out there doing
Right.
stuff. If you talk about college, they want to make lineups,
Right.
all these things. So it's like, really educating why it's important and what can happen if you don't. And then educating coaches on the other side, what is an appropriate response? Like,
Yeah.
is just resting, like just telling them to rest a week and then come back? That's not really appropriate. Like, should we just be getting an ice pack and sitting ice on? I would say at this point, unless it immediately happened, no, we shouldn't be icing all the time. There's just all these things coming out that change. And I think that, I love when I have a handful of coaches that like reach out and ask me questions and
Mhm.
want to talk about stuff, and they send their kids even if they're virtual, like, why don't you have Jenny look at this a little bit? And I love that because I love that relationship of them wanting to learn, them wanting to do, because you'd like to think all coaches want to do the right thing, but I have some coaches who told kids not to come to me because they don't like the advocacy part. They don't want me to teach the kid that they should be, speaking up when something doesn't feel good and things like that, which that's just kind of that older mentality in my opinion.
Well, and, you how do I say this? You're not gonna be able to, change everything. You're not gonna be able to change
No.
everyone's mindset, but I do think so. Going back to, like, NCAA gymnastics season, so we're at the halfway point, and I feel really good about every single coach's call that we get on.
Good.
They are so open
Mhm.
about, it's almost like they used to be, it was like, "Oh, my team is so healthy, I'm fine. Everything is fine."
Right.
And now we're seeing more and more like, "No, we're resting." These teams are getting more depth, which obviously allows for more athletes to get opportunity, but also allows for people to rest. And I think years back, resting was nobody really did it. You didn't
Yeah.
rest until it was like you had to. And now it's almost like we're again preventing the
Right.
tiredness, preventing the injuries because we're allowing like, "Hey, this is nagging me a little bit. Not a problem.
Yep.
We have a whole team behind
Mhm.
you." So what are your thoughts on just kind of how kind of like the midseason check-in that normally happens this year where, you might see teams you're like, what's going on over there? I feel like nowadays it's really positive. Like the halfway point has turned a page of like, "Hey, guys, we got this. We're healthy, we're happy. We
Yep.
got it."
Yeah. I think, one thing is kind of checking in at that point of, how are we feeling? How are we
Yeah.
doing? Like, one, we care about you.
Yeah.
We want you to be good. Feeling good is going to make better gymnastics. I do think people are starting to realize that too, right? Like,
Mhm.
yeah, you can get frustrated and you want kids to be tough and you want them to push through things, which I totally understand that piece of it. Do
Mhm.
we have to rest when something hurts a little? No, not necessarily. But I think just that thought process of one, I want their body to be healthy because I care about them as a person. But two, they're going to do way better gymnastics at the end of season when it really matters more
Yeah.
because their body feels good. Whereas you're not gonna have a good landing if your ankle hurts or your knee hurts or your back hurts
Mhm.
really bad. Like you're not gonna be as good at gymnastics. So I think one, coaches realize that. Like if I have healthier kids, they're gonna perform better.
Mhm.
Healthier bodies are happier, and then it makes it more fun, and then that's a better culture. So all of those things matter. So I think, looking at it and saying, also, I think it's really common to, hey, this is hurting. Like one, at this time, there's a couple options we have, right? Obviously, depending what hurts. One, we can rest and we cannot do these things. Or we can say, what part of it hurts? How could I work this in an exercise? Or how could I work this in a drill that allows me to continue to work pieces of it without the discomfort? So now I'm still
Mhm.
training and I'm actually probably making my body better. So I know
Mhm.
when something hurt on me, we just rested. I like went and rode the
Yeah.
elliptical or we did something else. And
Yeah.
also, in the past, and hopefully this is changing some, people are pretty quick to do injections because they want them back doing stuff. But, realizing, is that always the right answer, right? Is it sometimes there's a risk versus reward? There is research that shows like doing injections like Achilles or rotator cuff can lead to more tears. So like, are
Yeah.
we doing something for short term versus long term? Like, what are
Mhm.
the risks? Um, and I think some of that's just knowledge, right? What do I
Yeah.
know? What does the staff around me like? Are they comfortable giving progressions or are they more comfortable saying, let's just do this band work and not do gymnastics? Because doing parts of gymnastics is always going to be a little bit better for getting back. It's just, can I scale it enough that it makes it feel good and be beneficial?
Yeah.
I think that's an important part. You said like me mid-season check-in. I think one, you can say we're doing great. Let's keep it up. What else do we need? Like
Yeah.
honestly, everyone, how does our body feel? Where are our
Mhm.
backs at? And then if you're like, we're feeling a little okay. Well, what can we do about that? Right? Do you
Yeah.
have your trainer or your strength coach come and talk about something? Do you reach out and be like, hey Jenny, could you do a webinar? Right? Could we talk about like back care because
Mhm.
we'd really like for end of season, we're starting to get some more achy backs, which happens this time of year, backs and ankles, just achy, achy.
Yeah.
So, what can we do where we really care about this and we want them to be working on it? Because it's also not something that always has to be practice time, right? It's
Mhm.
something that's like, what are you doing the other time? If you're only doing stuff in the gym or for lifting or whatever, 20 hours, like, are you sitting around with your poopy phone posture? Are you getting into weird positions? Are you not
Mhm.
doing some things? Like a big piece of how I've been training backs, probably since I like really figured my back stuff out, works a lot on like breath work, and how to use your diaphragm properly. And so like, wow, we breathe all day. So maybe that's something you could just work on. So it's just like I said, the knowledge of it and like, what are you doing for your body to keep it healthy the
Yeah.
other hours that are, the other 16 hours a day when you're not at practice.
Yeah. You talked about posture as I'm like hunched over in my
Me too. I was
chair,
like sitting like
shoulders
leaner
hunched. I'm like, oh,
and sit
yeah,
with a
I
thumbs
think,
up.
well, I have terrible posture. I know it. I think it's really important to know your strengths and your weaknesses.
A
And
hundred percent.
one of my weaknesses is my posture. It is so bad. It is so bad. But it's fine. I know again, I am well aware of this, but it's interesting. So in elite, I growing up, it was very rare to have a coach in general be like, "How are you feeling today?"
Mhm.
Where in college, the first time it was brought up, I just remember I responded like, "I'm fine." And they're like, "No, like, how are
'Cause
you
that's what
feeling?"
yeah,
I was like, "I'm fine." And it kind of took some digging, and then I was like, "Oh, you actually like really want to know like how I'm feeling." Okay. And it really does there's a huge mental shift, I think, from obviously from elite to NCAA, and I think it's so amazing seeing so many elites just find this joy
very
in
amazing.
gymnastics, and it's just so funny. I'm like, just started thinking, I'm like, wow, one question completely will change really the way you do gymnastics. How are you feeling today? Actually, you know what? I'm a little sore. Got a lot of studying to do later. Like, and then they can adjust it, which is why gymnastics is such a unique sport. It's so individualized while being a team. But like, there's just so many elements I feel like that go into what a gymnastics team looks like.
Totally agree. Yeah.
Jeez. Okay. So what would you say is the most common ache and pain that maybe you see this time of year? And you might have already hit on it,
A mix of
earlier.
backs and ankles. I mean,
Yeah.
I've had a lot of ankles that don't feel good recently. Um, and that's usually a short landing.
Yeah.
I think a lot of times, I mean, I know I brush that off. I like would land short and it would hurt and we'd tape it up and make it really tight and I'd ice bucket and never really do stuff to improve
Oh,
how the ankle moved and the swelling and that kind of stuff. So,
yeah.
ankles is a big one. And I really try, like, we cannot take short landings. Like, I'm not going to tell you not to do stuff, but,
Mhm.
if we're landing short and we're landing short frequently, you're
Yeah.
really not going to be good by the end of season.
Yeah.
So, talk to your coach. Like, is there something else you could work? Is there another surface? Can we work on air awareness? Like, because really, if you know
Yeah.
you're going to land short, why are we trying to land? Like, let's just
Fair.
figure out how to not crush our ankles like that.
Mhm.
So ankles has been big lately, and then backs really creep up this time of year. I think, I think that some of it is meets. One, you don't feel good
Yeah.
and you're going to push through more than this. So there is this little bit of, oh, I'm competing, so I don't have time to like take care of my body.
Right.
But the other is, I think that like going to meets actually like really bugs people's backs. Like kids for the most part stand the whole time. They don't do much sitting. They don't always do like a good job of warming up different things like in between. So I actually was
Mhm.
thinking about this the other day because I have a girl I work with virtually who wears, one of the big like the Venoms, the back braces that like heats
Mhm.
up and can vibrate, and
Yeah.
telling me she's really sore after meets. And I was like, hmm. I started thinking, I feel like, people do things like that because it makes their back feel better in the moment. But in
Right.
the end, you have this thing on that's making none of your core muscles have to work. And
Right.
then you're taking it off and you're going and doing a floor routine. So then your muscles and your brain are like, what just
What is
happened? And
happening?
so then it gets so tight after. So like, I try really hard with my kids, like, hey, you got to bring your loop band. You got to do this, this, and this before being, or you got to
Mhm.
do this, this, and this. Like the more we can prep our body, or what can we do while we're standing when our back, you're standing there and your back's just starting to clench and get tighter and tighter. And like, how can I do a breathing exercise or not necessarily sit on the ground, but do something to get that to relax or loosen up? So I think that's part of this time of year is one, we're very,
Mhm.
very focused on gymnastics and not resting. I
Yeah.
think that we aren't as, we're not as willing to rest or give our body what it needs. I also think, like I said, meets can be hard on the body because you're on different surfaces. You're standing for a long time. You usually don't do a good cool down. There's all these things that are just different about it that we could be better at. Um, and then I also think that because you're so focused on gymnastics, for a lot of people, they do less strength work. And I just think
Mhm.
that's a mistake. Like,
Yeah.
it only takes, 2, maybe 4 weeks for your body to start get weaker. So if you aren't still lifting or you're not still working on these things and you're like, oh, but we need more bar work because our bars haven't been good. And then you're not really doing shoulder or upper back strength, your bars probably isn't going to get better because your upper body is going to get weaker. So there's this little bit of like, we're so overemphasized on the gymnastics piece where really true physical preparedness and being strong still matters a lot in a body doing well. So I think those are the pieces of it.
Yeah, it's funny you mentioned like standing around. The first time I did like a camp after college, like graduated, whatever, I kid you not, I thought my back was broken because I was like, how do people stand for this long? Again, I'm sure that my posture was not great, but I was like, oh my gosh, like I don't know how. I just, it was very mind blowing to me. Like, how is standing this difficult?
Some of the worst pain I've ever had is weekends that we would have like 3 or 4 sessions in a day of a meet. Because it's just the standing and the walking and the standing, and like you're never resting it. And it's just because like I didn't know how to use certain parts of my core. And so then as I got more fatigued, I just locked that back in. And then it's just
right. You just squeeze your back and you're just like, I'm
you
fine.
Squeeze your back.
It's fine. It's fine.
You squeeze your back.
Yeah.
Just when you feel like your back hurts, I don't know, just try to squeeze your butt. I don't know. Try something different. Don't just arch your back.
I mean, when my back hurts, I put on my seat warmers in my car and I just sit for like,
isn't that the best? Oh,
it's kind of pathetic that it's like, 85 degrees here and I still have my seat warmer on. Just for my back.
Bridget, let's fix your back.
Yeah, I'll get to it. I know. It's yeah. And again, I do think there are a lot of injuries with gymnastics. There's a lot of injuries with sports like all around. It's not just gymnastics, but I will say gymnastics injuries tend to be very precise. Maybe that's the word I'm looking for. They're very like there's a certain injury that you're like, you're a gymnast. Like I remember going into PT for the first time. They didn't know a lot about me. And I was like, oh yeah, my back. They did like one thing. They're like, you're a gymnast, aren't you? And I was like, yeah, no. Yep. So I think it's interesting to think about all these things. And you mentioned like doing all this core work. And I'm thinking back, like, I didn't do like any core work when I was training in elite. So it's probably
you didn't do pike ups on bars.
I mean, I did. If you ever talk to Samantha Peshek, she'll tell you I was a very lazy. It's amazing that I was able to accomplish what I did because I was pretty. I did the minimum. We'll just say I did the minimum. I got by.
Fair enough.
Again, know your strengths, know your weaknesses. That's
100%. 100%. So it's just that means that you had a really strong gift.
I had, something. I had something going on. So lastly, I do want you to be able to kind of talk about maybe some things that you recommend for, it sounds like preventative work is kind of key here. Don't let something get so bad. Let's address it kind of early on. So what is some preventative work that maybe anybody that's listening is like, oh yeah, I can relate to this, but what do I do about it?
Yeah. Yeah. So I think, some of the best preventative work is the littlest things, right? Like when we're sitting, if we like sit or we have like, we're on our phone and we drive and think about how we're like this all the time, right? But then we're going to go. So I told you I had back stuff. I've had some ankle surgeries, but I had a shoulder replacement in my 30s. Like that ended my competitive CrossFit career. So when I say like my body did take a beating, like I really don't. You shouldn't be like 35 and feel like, oh my gosh,
right,
this is it. Like I can't still be an athlete or I have to. My shoulder's great now. It's really good. I had a fantastic surgeon. It's very, very good. But like things like that where I truly like, when you're like 19 or 20, do you really think about when you're 40? I don't think that much, but like
I felt really, like I was 40.
Right. And it doesn't have to be that way. But I feel like I felt like that was normal. Like that's how it was supposed to be. That's a big piece of it. So I would say some of it is just like, can I spend some time sitting, like palms up, shoulders back? Like if I'm in this externally rotated position in my shoulder some of the time, I'm going to be in a much better position to go swing. Whereas if I am sitting like this all the time in internal rotation, and then I'm going to go try to do like a blind into a Jaeger, like this full external rotation. Yeah, no wonder you get a labral tear. Like you've been sitting with this like dookie shoulder position with your pec pulling you forward, and like you just don't have good positioning to go do gymnastics. So literally you're sitting there and you're listening, like turn your palms up and rotate them away from your body, but don't arch your back when you do it. So now if I do that, I arch my back, that's a whole different problem. So I think some of it's just how we behave during the day. Another easy one you can do that can go a far way is, or a long way, is I told you about breathing. Like you have a diaphragm. It goes like this. When I breathe in, my diaphragm should push down, which means my midsection would get bigger. But most people, when they take big, deep breaths, they like puff out their chest and arch their back. And so my diaphragm probably didn't do anything like it was supposed to. My back worked, my neck and shoulders worked to breathe. That's not really what's supposed to happen. So if when I'm breathing, that's your first exercise, Bridget, is just breathe.
I'm over here like,
you breathe in your nose, you expand your midsection on the inhale, and then you think about having some like engagement in those abs, not clenching, not crunching, but just like, can I get my sides to work a little bit when I exhale? And so just starting to think like, can I create some pressure in my midsection, which that pressure is then doing all kinds of great things. It's helping with digestion and doing stuff like that. But it's sending a message to my brain that I'm safe and it can turn those low back muscles off a little bit. So that's an easy thing to do. And then we talked about this, like do your hamstring curls, and do your hamstring curls. And then I would say, don't force when something hurts, forcing something into motion. So short landings is a big one. That's something I'm seeing a ton right now. If you're going to keep taking landings, you're going to actually do actual damage to your ankle. And then it's not going to feel better in the summer. And then you're going to land short again. And then you're going to have bad ankles the next year. And so, really sometimes realizing that fully addressing an issue and not rushing back, that's not necessarily preventative, but I would say that is your best bet. The people that try to rush back and they're like, oh, it still hurts a little, and it never feels better because it always still hurts a little. You can, for most injuries, you can get things better. You can really you can't heal a labral tear, but you can get back to full functioning bars with a labral tear without surgery. That is very possible. You can have a stress fracture in your back and not have back pain again. That is possible. Like those are things that I think we haven't always thought. A lot of times people are like, well, I have a labral tear in my shoulder, so I have to have surgery. But like, not necessarily. I mean, if it's bad enough, maybe, or you're unstable, maybe. But what if it's just bothering you because of the position your shoulder's in? And what if we can fix that? So I think that if you're listening, obviously I am a physical therapist, so I care a lot, but I'm very movement-based physical therapist. So, just doing your cupping or your needling or your e-stim or your massage or your scraping and taping, like those are all modalities to just help you get through. They're not actually solving a problem. So I would say the best answer is figure out the root cause of the problem and then really get to addressing that. And if you're not hurt, do your hamstring curls and breathe into your belly.
That wraps up today's episode. I hope you all enjoyed it. Be sure to tune in each week because we'll be dropping new episodes from the amazing guests that I have lined up for you. I'm your host, Bridget Sloan, and this is season 3 of Flipping Out with Bridget Sloan. Please make sure to like and subscribe wherever you listen to podcasts. I hope you all have an amazing rest of your day. Let's make some good life choices out there, and don't forget to be awesome. Bye, guys.